Good afternoon. Welcome, everybody. I just want to introduce our MediaForce PR is here today. We're doing a webcast, and I wanted to introduce Sarah Moran, who is from MediaForce, who's our project manager and master of ceremonies, and she's in charge of all this new webcasting thing that we're doing, and she's going to tell you about our social media program.
Yeah.
Sarah.
Well, thank you very much, Judy. I'm Sarah Moran. I'm with MediaForce PR, and we are a former graduate of MEC-Fairfax and the incubation program, and we are so happy to be back here helping MEC-Fairfax out with social media and webcasting, and we've also done some promotion of the MEC events. So with that said, here today I'd like to encourage you to connect with the MEC-Fairfax via the social media channels. They are currently on Pinterest, LinkedIn, and Twitter. So the information is up here, and it will also be available at the end, I believe. So please do keep in touch. We like to share information about different events and other happenings and news that's going on with the MEC, as well as information that benefits small businesses and business owners. And with that said, I guess I'll just give you a little quick information about MediaForce PR. We are a social marketing firm, and we specialize in creating and distributing public awareness campaigns. And we will be here for the duration of the event, so if you have any questions for us or have any interest in learning more about our marketing services, we'll be in the back and you can come talk to us. With that said, I'm going to turn it over to Erica.
Okay.
I'm just going to get her presentation loaded back up.
Well, good afternoon, everyone. I know that you're here for a lunch hour, so we will try to keep this to an hour to get you out and on your way. But I'm glad you were able to join us. Thank you to Judy for having us for the Lunch and Learn on the Affordable Care Act and your small business. I'll start by giving you just a little bit of information about me and my organization, so you know a little bit about why I'm presenting on this. My name is Erica Dowell. I'm Southern Outreach Manager for Small Business Majority. And I actually grew up in a small business in Virginia, so it's always nice to be able to give this presentation in Virginia. My mother and grandmother owned a florist, a flower shop in Southwest Virginia, so it's nice to be here to give the presentation. To give you a little bit of information about Small Business Majority, for those of you who aren't familiar with our organization, we are a small business advocacy organization. We were founded and run by small business owners. Our executive team are all still small business owners. At this point, we are a national organization. We have offices in Washington, D.C., Virginia, Ohio, Colorado, Missouri, New York City, and several locations in California. We believe the best way to know what small business owners want and what they need is to ask them, and this is the driving factor in all of our research and advocacy. We have been very involved in healthcare, energy, access to credit over the past couple of years, but we're moving more and more into taxes and budget issues as they come up, as issues become important to small business owners. We're going to try to stay on top of them as they're in the news. It's important, I always start out presentations by describing exactly what we consider to be a small business, because there are a lot of definitions out there. So we focus our research and we focus our outreach efforts on businesses with fewer than 100 employees, as well as the self-employed. And together that's a group of about 28 million Americans, so we do have our hands full with just that group. So if you have any questions, we're going to have a Q&A at the end of the presentation, so I would ask you to hold those until the end. So I certainly don't have to point out to small business owners in the room that healthcare costs are a huge cost to small businesses. They're usually only second to payroll as the biggest expense for a small business owner. The soaring cost of health insurance, especially for small businesses, 25% of small business owners are currently uninsured. 28% of the self-employed in population not covered by any insurance plan. And small firms have paid in the past, on average, about 18% more than larger firms. And we're going to talk about a few ways that the Affordable Care Act is going to help to reduce that difference felt by small businesses. And I do want to take just a minute to point out that we don't think that the Affordable Care Act is a perfect law. It certainly is not a perfect law, but it may be a step forward in helping to reduce costs for small businesses. So while it's not perfect, it's a right step for small businesses. We're going to talk about a lot of the different provisions. I want to highlight a national study that we did. Small business health cost would have more than doubled had nothing been done, so had the Affordable Care Act not been enacted. to about $2.4 trillion by 2018. So I also want to point out just a couple of points from our opinion surveys. We found that small employers who don't offer coverage cite a lack of affordability as the biggest reason why they're unable to offer to employees. And 72% of those who do offer say that they're struggling to be able to continue to offer to employees. And I've worked with small business majority for about 2 years now, and I've spoken to business owners across the country, and the one thing that I took away from it is that they really want to be able to offer health care to their employees, whether that's because they want to draw in quality employees like a bigger business is able to do, or they feel like it's helping them to stay competitive with larger businesses, or that they just think that it's the right thing to do. Small business owners that I've worked with in the past really want to be able to offer. A couple of points about the Affordable Care Act, the new federal law. It does build on our existing healthcare system. It will aim to rein in healthcare costs, so it will reduce the deficit by over $100 billion by 2020 and by $1.3 trillion by 2030. These were estimates put out by the Congressional Budget Office, which is an independent office in Congress. And I know it was in the news just a little bit, but it was upheld by the Supreme Court June 28, 2012. And from that point moving forward, implementation is primarily going to be the responsibility of the states. So that's why it's important to learn exactly what's going on in Virginia, because if you do own a Virginia small business, you're going to want to be paying attention to what's going on in your state from that point moving forward. So there were several immediate benefits that went into effect when the law was signed, but other key provisions are rolling out over the next couple of years toward 2014, and that'll be full implementation. So I want to start by pointing out just some immediate consumer protections that went into effect. And I always start with this list because sometimes they're in the news and you don't realize that they're part of the Affordable Care Act. But insurers will no longer be able to deny coverage for patients with a pre-existing condition. This went into effect in 2010 for children, and it'll go into effect in 2014 for adults. And we're going to talk about a bridge program to get adults with a pre-existing condition from now until 2014, when they'll be able to start off getting health care inside of the exchange. But as of August 2012, 2,020 Virginians with a pre-existing condition had access to health care that they weren't able to get before. There's a ban on lifetime caps that set lifetime limits on coverage, so you're not going to have to worry about hitting that individual cap for yourself if you do have an illness later in life, or if you do find yourself in an accident, you don't have to worry about hitting that cap. So this has the potential to impact nearly 3 million Virginians, 1 million women, and 800,000 children. Adult children are able to stay on their parents' health insurance plans until the age of 26. As of December 2011, this was a number about 3.1 million nationwide, still able to have insurance until 26, and we can point to 66,000 young adults in Virginia. It bans health plans from dropping coverage when someone gets sick if either the employee or the employer makes an unintentional mistake in the paperwork. So they can't point to that and say you made one mistake in the paperwork, so we're not going to be able to offer you coverage. First dollar preventative care for all new plans. This went into effect in 2010, and this has been in the news a lot because this has been rolling out as the Affordable Care Act gets closer to full implementation. But we can already point to 54 million Americans nationwide able to take advantage of this provision. This includes 1,500,000 in Virginia with private insurance plan that now have preventative service with no cost sharing. And I pulled a list of services where this would be applicable for no cost sharing on private insurance. And that's examples of this is like blood pressure tests, diabetes tests, many cancer screenings, flu and pneumonia shots, and counseling on certain topics such as depression or smoking cessation. And increased access to care. There's been a real focus in community health centers to help provide some preventative care for people who do want to go to community health centers. This went into effect in 2011, and this was just increased support for the 25 health centers here in Virginia, operating 148 sites, providing preventative and primary health care to Virginians. So to move into what we focus on for small business owners, I will be talking broadly about 3 provisions that we found to be important for the small business community. It will provide an immediate tax credit for most small businesses. We're going to talk about eligibility requirements and how to find out if you're eligible for that. And provide immediate access to a pre-existing condition insurance plan. It's also called the PISA Program for individuals and the self-employed. And this can really help individuals who do have a pre-existing condition. I always give my friend, he has kidney disease, as an example. If he wanted to start his own business, he would have had trouble in the past either even getting a quote or having healthcare that would have been affordable enough for him to leave a position to start a business. So this is helping, by eliminating that pre-existing condition as a barrier to get insurance, it's helping to eliminate job lock, and perhaps more people in the future can leave to start businesses. And then we're going to talk about the marketplace, the shop exchange, the exchange in general. I know there's a lot of information out there, so we're just going to give a broad overview of how the exchange should work for small businesses, and then I'll give you an update of what's going on in Virginia. So the small business tax credit available in the Affordable Care Act is going to be available to the smallest of the small businesses. It's available to businesses with employees, so this one is not able to be claimed by the self-employed. It took effect in tax year 2010, but if this is the first time that you're hearing about it and you were able to claim it, you just didn't know about it, you can go back and amend your 2010-2011 taxes. Businesses are going to be eligible if they meet 3 requirements. You have fewer than 25 full-time equivalent employees, average annual wages of less than $50,000 to those employees, and the employer does need to pay at least 50% of premium costs. So this is pulling from a report we put out in May of 2010, and this was just looking at how many businesses with those eligibility requirements had the potential to claim this credit. So that would be 102,600 Virginia small businesses are potentially eligible for that credit. That's about 80% of all businesses here in Virginia. 30,700 businesses eligible for the maximum credit. And I'm going to tell you what that means in just a second. Nationally, more than 2 in 5 small business owners who qualify for the credit are going to be eligible for that maximum credit. And this is going to have the potential to reach about 19.3 million employees who work for businesses that can benefit for the credit. And to give you an idea of what has already happened in regard to this credit, in 2011, $15.4 billion went out for this credit alone. And that was an average in about $800 in savings per employee of the small businesses. So this credit is going to work on a sliding scale. What does it mean to get the maximum credit? It's going to work up to a maximum of 35% of premium expenses from 2010 to 2013. And then once the exchange is set up and the small business owner accesses health care through the exchange, it will bump up to a maximum of 50% of premium expenses for any 2 years beginning in 2014. Once again, the tax credit does not cover premium expenses of owners or their families. A couple of points about this. Typically, owners do make the most in a small business, and this was implemented as an added incentive to give business owners who did want to take that plunge and begin offering health care to their employees, just a little bit of incentive to do that. Tax credits cannot be claimed by the self-employed, and once again, if this is the first time you're hearing about it, you can still go back and amend your 2010-2011 taxes, or if you are able to claim it this year and don't post a profit, you can carry it back as far as 2010. Business owners, small employers, businesses, or nonprofits, both going to use the same form, Form 8941. It's available on the IRS website. It's also available on the Small Business Majority website. Businesses will include the amount of the credit as part of their general business credit on their income tax returns. This credit can be reflected in determining estimated tax payments for the year if you do your payments that way. The credit will apply toward income tax rather than employment tax. So I'm going to move over to the PISA program, the Pre-Existing Condition Insurance Plan. It was at one point also called the high-risk pools. This is for individuals who weren't able to access health care in the past because of a pre-existing condition, or access to health care that may be more affordable for people who do have a pre-existing condition. It was available immediately to individuals, including the self-employed population. Eligibility, individuals have to have been uninsured for at least 6 months, and have been denied coverage based on a pre-existing condition. And you can prove that one of two ways. You can have a letter from your doctor talking about your pre-existing condition, or you can have a denial letter from your health insurance company. And I get a lot of questions as to whether this will actually be affordable for people who are able to use it. And as compared to what they were paying before, this is going to be affordable. $5 billion is invested in this program over 5 years to help make sure that they're able to access health care. And it will be available once again until 2014. So this is just a bridge program. And once the exchange is set up in 2014, then people with a pre-existing condition can start shopping inside of the exchange. Can we take questions at the end? In Virginia, we can already point to 2,200 people who have been able to access insurance through this program, and there are plan details available online. If you want to visit that, it's the PSIP website, psip.gov. There are a lot of questions I've had from business owners about medical loss ratio, the 80-20 rule, and how that's different from rate review. So the next two slides are discussing just a broad overview of what this is. You may have gotten a letter from your health insurance company explaining this, but it requires insurers to spend at least 80% of their premium expenses on actual medical claims or quality improvement programs. This is going to limit profit and overhead costs to 20% of premiums collected. And if they do exceed that, then they have to cut a check and send it back to the people in that plan. It's estimated that $1.1 billion will be given back in 2012. This was in Department of Health and Human Services estimate. And nationally, we can point to average rebate per enrollee in the small group market of about $76, and rebates of $377 million in the small group. It's about 28% of small employer plans seeing a check in the mail. Here in Virginia, it's an average rebate of $181 and total rebates of $22 million going back to enrollees and plans, and 236,171 business owners to be affected. Okay. Rate review, how that's different from the 80-20 law or rule. It's in the news a lot. So insurance companies are required to publicly disclose any increases of more than 10%. And I get a lot of questions. I've never actually had one from a business owner, but I've had business owners ask, how this is going to work, but they've never asked, why it's not more than 10%. Business owners in the past have seen increases of 20 and 30, 40% every year. And I had a business owner in New York tell me that if he just had a 10% increase every year, he would dance in the streets. So this is going to help to curb those increases that small businesses have felt in the past. They have to post it online to give customers a chance to comment on the explanations, and the state can approve or reject any unreasonable increases. In Virginia, you do have a partial state-based rate review program. You can view all of this on healthcare.gov, and I'm going to give you that website at the end. It's the Health and Human Services website. It's actually very helpful for business owners if you want to learn more about any of these provisions. So I want to give you an overview of the exchange. I know that you hear it a lot, and there's a lot of confusion and a little bit of fear about it because it is something a little different than what's been done in the past. So we've been talking about it as more of a large marketplace for shopping for healthcare. So if I own a business in Virginia and I have 5 employees, in the past when I wanted to go and get health insurance, a company is only looking at these 6 individuals. So there may be more risk that one person may have a baby or have an illness or get in an accident. So the risk of insuring a smaller group may be higher, whereas a larger business can go and get insurance and you have more healthy people in the system to spread that risk among. What this is going to do is pull together businesses like mine so that we look like a larger business when we're shopping for healthcare. So it's going to increase buying power by increasing those purchasing pools and help to reduce those administrative costs because those were largely fixed. So when you had fewer enrollees to spread it across, it can be a stronger burden on small businesses than it would have been for larger businesses in the past. Small businesses with fewer than 50 to 100 workers are going to be eligible, depending on where you are. And private insurance plans are going to be competing for your business. It's not going to be a public option. It's going to be the same private insurance you've had in the past. This is just an avenue to reach it. And it's going to help to improve competition and increase employer choice. Exchange will be able to negotiate on some level with insurers on behalf of the small businesses to ensure higher quality and lower cost. We always point to a RAND study. They estimate that these exchanges will help to expand coverage to about 85.9% of small business employees, which is up from about 60.4% today. And that's an overall increase of about 10.5 million workers in being insured. So if you've ever shopped on an Expedia or Orbitz.com, this should be a very similar system for shopping for healthcare. It should be a one-stop shop web portal accessing health insurance. You should be able to log in, compare plans, and get detailed information about price, quality, and service. You should be able to shop based on price, quality, or service that you want to be able to provide to your employees. The plans are going to be organized by category: bronze, silver, gold, and platinum. And what this means is that bronze and silver are going to be more mid-level plans, and then you could step it up if you want to. And these are based on, you can think of this roughly as the percentage of health insurance costs covered. So it's going to be like 60% of all healthcare costs covered, 70, 80, 90%, if that's a little easier to kind of imagine what that is. And then a calculator should be available online to help you kind of compare. And then it should really streamline the billing process. You should be able to log in, cut one check, and kind of be done with shopping for healthcare. Small business workers and the self-employed will be eligible to receive affordability tax credits toward their own individual premiums, up to 400% of the federal poverty level. It's approximately $90,000 for a family of 4. And this program should really help to ensure that more money is going to medical care and reducing administrative costs. And we've talked about a couple of ways that this is happening, whether that's the 80-20 rule, making sure that 80 cents on a dollar is going to actual medical claims, or helping to ensure that there are not increases over 10%, or the small business tax credit, or even just the pulling together, helping to make sure that it's a larger group of small businesses inside of it. And there are other incentives for administrative efficiency and modernization. I know you've heard about electronic medical records and things like that. There are incentives out there to kind of modernize the process. And the expanded coverage and individual responsibility requirement should help to reduce that hidden tax we felt in the past when you had health insurance. So we've done presentations with HHS Regional Director, and they've cited that as about $1,000 a person in the past if you access health care. So by helping to make sure that there are more healthy people in the system, should help to reduce that hidden tax felt in the past. I want to stop and take a minute to explain this. I think I get 80% of my questions on this slide alone. But businesses with fewer than 50 full-time employees, that's 96% of all businesses in America, are actually going to be exempt from any requirement to offer health insurance. And I know that this is something that is kind of distorted in the news. But if you have fewer than 50 full-time employees, you don't have to offer health insurance in 2014. Now, we've talked about a lot of ways that it may be easier and more affordable for you to offer to your employees. And I know I've worked with businesses for 2 years, and it really seems to be something that business owners want to do for their employees. So in 2014, it may be a little easier. You can start to examine your options again. But if you have fewer than 50 full-time employees, you won't see any requirement to offer health care. 96% of all firms in the United States have less than 50. So firms with 50 employees or more, that's only 4%. And typically, bigger businesses are able to offer health insurance as part of their benefits package. Of the 4% who do not offer coverage, that's only 0.16%. So this little red portion is the only portion that will be affected by the requirement. Because the other 4%, the other 3.84% have already offered health care in the past. To give you an idea of what that means, so for large employers, over 50 full-time employees, it can only apply to 4% of businesses, but the potential penalties for those large employers are failing to offer coverage and failing to offer affordable coverage. There are only 2. Failing to offer coverage at all is $2,000 per year for each full-time employee, excluding the first 30 full-time employees. So you'll take the total number of employees and subtract 30, multiply it by 2,000, and that would be the penalty. The other penalty would be failing to offer affordable coverage, and that would be $3,000 per year for each full-time employee receiving help in the exchange for their insurance plan. And so you'll pay one of the 2, you would not pay both. What does it mean to be affordable? Because I know that's kind of a vague term. That means that the premium expenses exceed 9.5% of household income of the employee, or it pays less than 60% average of healthcare cost for that employee. And that's based on an individual rate. And plan premiums, based on the individual rate. The affordability penalty can't exceed that of failing to offer coverage, and businesses will pay the lesser of the two penalties. And it's determined monthly, and here's a little bit about how it is, and I know this is something that we'll get more in the weeds on after 2014, but to give you an idea, seasonal employees will count only for months where they are a full-time employee, and that's 30 hours a week, and no penalties of businesses, once again, with fewer than 50 full-time equivalent employees, and that's about 96% of all businesses. So I've had questions that in the past, the Affordable Care Act has been around for a few years, but I haven't seen my health insurance premiums go down. Can you explain that? Yes, okay. So this chart is helping to explain that. This was done, the Affordable Care Act fully implemented in 2010, so only those initial programs went into effect for this particular chart, but this is just showing that the Affordable Care Act, like you may never see your premiums go down, but it's helping to curb increases, if that makes sense. So in 2010, the programs that were already available were helping to save money for businesses. So without reform, it would have been an increase of $3,760. With the Affordable Care Act, increases of $3,480. And I know that's a very small difference, but it's helping to save on those increases of about 7.4%. And this is something that we'll know more about as soon as everything is in place and it's fully implemented in 2014, and we can kind of revisit this and see if it actually is helping to save money for small businesses. A couple of points, final points. States will be able to determine whether to keep the individual and the small group market separate or to merge them in the future. Insurance will still be sold outside of the exchange. Don't think of yourself as forced to use the exchange. You can still shop outside of it. Insurance plans will be available outside of it, but a lot of the cost-saving measures that we've highlighted today won't be available outside. So pulling together of small businesses or the small business tax credit, things like that will be available inside. So just be aware of that when you do evaluate your options. And Senator Warner, Senator Kane, and their staff will be required to use the exchange as well. So this is just giving our members of Congress added incentive to create something that's going to work, because they'll be right in there with us. So, to give you an update on the Virginia Exchange, this is a relatively new development, but in December of 2012, Governor Bob McDonnell announced that Virginia would not continue to move forward on a state-based exchange. So here in Virginia, we will have a federally facilitated exchange run by HHS, Health and Human Services. So this is really important because in the news, you're going to hear more about the federally facilitated exchange, and that's what we're going to have here in Virginia. So you can just start to look and learn a little bit more about that, and you can really be aware and on top of things as it rolls out. Important dates to keep in mind is that open enrollment will begin in October of 2013, and then it'll go live January 1st, 2014. So we'll be able to start using it January of 2014. Before I go through this, these are not regulations that have been confirmed by HHS, but just to give you an idea of how this is changing every day, we submitted comments. So they put regulations out, HHS did, and we were able to submit comments on how we felt about those regulations and what we think would be helpful for the businesses that we've worked with. So we submitted comments in December of 2012. I believe it was like December 31st of 2012. But so the regulations on creating a federally facilitated shop exchange, and that's what we're going to have here in Virginia. We're going to be part of that federally facilitated exchange. So I'll just touch on these briefly, but employers would be able to select one benefit tier. We talked about that: bronze, silver, gold, and platinum. And then this is helping to increase employer choice, but they'll be able to select any issuer within that one tier, and employees would have the option to buy up, and they would have the option to be inside of that tier. And allow employers to calculate employer contribution based on the per employee rate. You can kind of see how much you want to contribute if you do it that way. I contribute this much for each employee toward their healthcare premiums. You should be able to do that through the system. And the requirement that issuers participating in the individual exchange also participate in the shop. So any insurer, they've suggested that insurers participating in the individual exchange also provide options in the shop exchange, and we think that would be a good idea because it may help to increase options in the shop exchange. And they require for issuers to pay broker compensations be paid at a similar rate outside the exchange. And we'd like to see this more clearly defined because that's very vague. But we've worked with a lot of business owners over this past 2 years that have really leaned on their brokers to be able to access healthcare. And I know I get calls from small business owners, which is interesting because your broker is usually the one who calls saying, you know, it's going to go up, your increase is coming. But they're really concerned for their brokers' jobs and they want to see that they're still a part of the system. So we've kind of encouraged for brokers and insurance agents to be included in the system, and it's good to see that they will be at some level. And it was proposed that 70% employee participation rate, that's the level that they'd like to set to protect against adverse selection inside of the exchange. This would allow for the shop to adjust it based on state law, so states could change it. It's at 70% nationally, but states could change it if they find that that doesn't really work for their states. And an average fee of 3.5% to support the initial cost of federally facilitated exchange. But we'd really like to see that trend down. You know, there are going to be a lot of upfront costs for setting up a new system, but in time it should be cheaper, so we'd like to see that trend down. We'll see if that actually happens, but initially it's going to be 3.5%. I want to highlight a couple of resources before taking any questions. Once again, the National HHS website, it's healthcare.gov. It's amazingly helpful for small businesses. I get calls from business owners asking, you know, can you point me to an insurance plan? I can't as part of what I do, but I always refer them to healthcare.gov. You can select your state that you're a small employer, and you can see all of the available plans in the state of Virginia. So if you ever do have questions and you just want to see what's out there, I would encourage you to view this site. Our website can also be very helpful. There you'll find a couple of different documents that we've listed here. What's in healthcare reform for small businesses goes a little bit more in depth on those 3 provisions that I highlighted for business owners: PISA Program, the exchange, and the small business tax credit. And if you have any detailed questions, you know, I have this many employees, I want to know exactly how the tax credit would be calculated for me or things like that, you can either come see me, we can run through it, or you can visit our detailed FAQ if you have questions later. And our tax credit calculator, if you visit our website, it's going to be on the right-hand side of the screen. It's also going to be available on our Facebook page. We've seen small business owners in the past be able to log into this, and you kind of just put in your details and it generates what it believes your credit would be worth, and it can be a good first step in just getting the ball rolling and having that conversation with your accountant. You know, I saw this tax credit, I think I may apply, I may be eligible for it. Is it worth, you know, running through the calculations and filling out the paperwork to claim it? So a little bit more about Small Business Majority. We are actually a non-membership organization, but that being said, we get calls from reporters or government agencies hoping to profile particular kinds of businesses. So we've helped to put business owners on BBC, MSNBC. You know, we just get calls from reporters, and they're looking for business owners who'd like to talk about their healthcare situation, energy, access to capital, taxes and budget, whatever issue that you feel is most important. So we'd love to hear from you. You know, if you'd like to share your story, my colleague Emma Hollister, she's network coordinator, and she works directly with all of our business owners. Ways you can get involved: if you want to receive a monthly newsletter, we send out healthcare, energy, access to capital, taxes and budget right now, updates. We help business owners write letters to the editor and op-eds, if that's something you'd be interested in doing. We're able to do state events and roundtables and occasionally fly business owners into DC. I don't know how much use it would be to fly you guys into DC, but we could drive you in, to meet with representatives. And we do webinars like this one for business organizations. So if you are a member of a business organization and you'd like to have one of us come out to do the presentation, be happy to talk to you a little bit more about it. And our Facebook and Twitter. And I'll leave my contact information on the screen. If you do have any questions, you know, sometimes business owners don't want to ask in front of an audience, but if you do have any questions, feel free to give me a call or email me. And if I don't have the answer, I'm happy to help you find it. So, any questions?
Can you email this presentation to us?
I can, yeah. And Judy may help me do that, but yeah.
I do. I have it. I have all your information. If you told us you were attending, we will email it to you. If you Just RSVP, just send me before you leave and let me know.
Okay. And I also have a list of all of our national, I sent it over in the email earlier, but I have a PDF of all of our healthcare links, all of the documents that we've kind of developed over the years for healthcare. So if you wouldn't mind sending that as well, it can be helpful if you're looking for something specific. Sure? How many employees do you have? You're less than 50. Okay. If you have less than 50, you're not going to be subject to any requirement to offer health care. So if you wanted to expand to families in the future, if that's something that you've wanted to do in the past and you haven't been able to afford it, it may be more affordable in 2014. You're not going to be required to add additional people to your plan, but it may be worth looking into a lot of the options inside of the Shop Exchange and kind of how that may work for families of your staff members, and then maybe that's something you could do in the future. %70% of, you have to have a 70% participation rate inside of the Shop Exchange, and that's to kind of guarantee that, well, and that's a proposed rule right now, so we'll know more about that in the future, but it was proposed that 70% of employees be on the plan inside of the Shop Exchange to help prevent adverse selection. But as soon as they have a confirmed rule, then I can get back to you if you want to send me an email. Yeah. Mm-hmm. Yeah.
I was surprised to hear you say that Virginia is not setting up its own Shop Exchange.
I was a little surprised too.
Because previously they've been working on that, or the plan was to do that.
Mm-hmm.
So I'm wondering, A, why did Virginia not do that? And B, how many states went Virginia way as opposed to setting up their own exchange?
Sure, and that's a great question. He asked, it was in the news that Virginia was kind of moving towards setting up their own state-based exchange. Kind of why they did that, I wish I could speak for it. I have no idea why they didn't decide to eventually do that. I was kind of hoping they had, an exchange plan in a drawer somewhere they were going to pull out right after the election. I know that they were waiting, as a lot of states were, kind of waiting until after the election to kind of free up some of that uncertainty they had about the Affordable Care Act and this kind of going through. So a lot of states may wait and let the federal government kind of come in and do a first year and then maybe work with the federal government to take it over later. I know a lot of states have worried that they didn't have enough guidance to set it up on their own, so maybe that was the case in Virginia. But I'm sure that HHS, they'd like to take as many states off their plate as possible, so I'm sure they'll be willing to work with states in the future that want to take it over. Yeah.
Any idea currently the breakdown of states that have and have not?
It's a good question. I think it's just under 20 that are moving toward in a very certain way, setting up their own state-based exchange. I don't have the number exactly off the top of my head, but I can find it for you if you want. Mm-hmm. And a good website for, sorry, I'm getting to you, I promise. But a good website for that is actually, it's not on this list, but it's, if you just Google Kaiser state-based insurance exchange profiles, it's Kaiser Family Foundation, and they do a map, and they keep it very updated on the progress across the United States. So it can be a really good resource for that, if you're just out of curiosity tracking certain states. Mm-hmm. Yeah?
Well, a lot of these state budgets are in trouble, so it seems to me what Virginia is doing is they're going to rely on the federal government to run their program. Is that correct or incorrect?
Well, I can't speak for the state of Virginia, but that may be part of why they decided to kind of wait and watch the first year, how HHS is setting it up and how it'll be run in Virginia. But I know that state government would be more equipped to kind of make decisions on behalf of their constituents because they're going to know the people in their state best. So I know that a lot of states have expressed interest in really wanting to be able to control what happens in the exchange rather than have HHS come in and do it. So there have been a couple of different approaches, and that may be why Virginia has decided to wait.
Well, I guess my question is specifically this: what is the state of Virginia going to have for small businesses going forward in 2013? Are they just going to wait and see and be vague and not really provide anything?
No, we'll be assumed into the federally facilitated system. So they'll have a federally facilitated individual exchange and a federally facilitated shop exchange. So we won't not have anything. All states will have something. We'll have the federal system. So all states will either have a state-based system or a federally based system, and Virginia is just one of the ones that will in all likelihood have a federally facilitated system. Yeah?
There was a discussion in the Post that the concern in Virginia is bait and switch, that the federal money that subsidizes the state programs would eventually go down and leave the state stuck with much larger costs than what they initially planned.
Yeah, and I've heard that as well, and that may be why in Virginia, worried about future funding, but I know here in Virginia we're just going to let IHHS set it up the first year. Yeah?
About 15 slides back, you showed $5 billion in 5 years.
Yeah,
What
PISA.
happens when that goes away, or is that just something that's
No, that's a great question.
solution?
No, this was a bridge program, so it's a great question. These, yeah. So these people, exactly like my friend with kidney disease, if he for some reason found himself out of work in the past, he's going to be working to pay his health insurance. So this was a bridge program to help people like that who have had a real struggle like that in the past. Set up in 2010, and it went to 2014. So that was a $5 billion investment over those 5 years. And then once the exchange is set up in 2014, these people can shop inside of the exchange because there will no longer be that hurdle, that pre-existing condition hurdle. But that's a great question. Yeah.
You have employees, based in Virginia, you have employees all over the country, how will this work for them?
That's a great question. I've had that from a couple of people, and it kind of remains to be seen exactly how that'll play out. We'll have to wait until we have some additional details on the shop exchange kind of firmed up. But will you shoot me an email and let me know kind of the states, because it's going to depend on the states, and I'd be happy to look more into that and send you some information. Oh, I went too far. Oh, well, okay. It's I can give you my card. Okay. And I know I had a question right here. Do you have a question?
Here in this metropolitan area, you can have, we're a government contractor, so you have people that live in Virginia that work in Maryland or work in D.C. In some cases, maybe even West Virginia.
Yeah.